Hello, my name is Dr. Hillel Mazansky, and I specialize in medical hypnotherapy, guided visualization, nutrition, and exercise. My website being gianinc.com. Today, folks, I'm going to speak to you about something that's extremely important to your health, and that is vitamin D. Vitamin D is known as the sunshine vitamin and is absorbed through the skin. It is used in the body together with calcium for bone health. However, in the last few years, we have noticed that there is a national or even international deficiency in vitamin D, and that's been associated with many diseases. Low vitamin D is associated with cancer. Every cancer patient that we see in the office has an extremely low vitamin D. Heart disease, stroke, lung disease, eye disease, multiple sclerosis, and the list is growing. Every month or two, new articles are published in credible medical journals discussing the importance of vitamin D and its shortage, how it is related to the disease. The normal value of vitamin D is from 30 to 90. Toxicity can occur when the level is 100 or more. There is no physician in the United States or elsewhere who's seen toxicity from vitamin D. But all that the physicians warn their patients, if they take vitamin D, they've got to be careful of toxicity. The normal value is 30 to 90, with toxicity starting at 100 or more. It is suggested by many physicians who are leaders in the world on vitamin D, who suggest every adult should take at least 5,000 units of vitamin D3 every day after food. It is not a lot, because after 2 or 3 months it is recommended that you have a blood test, not to see that you're having too much, but rather to make sure that you're having too little. If you're at 30 or 31 or 32, the lower level of normalcy, it might not preclude you from getting disease. We suggest that your value should be at least 45, and then you will be protected. You take the vitamin D once a day after food, as it's fat absorbable. Make sure that you take vitamin D3 and not D2, as D3 is the active form. We have seen patients improve dramatically, even although they are on many different types of medications and getting radiotherapy and chemotherapy and cancer, etc. We have seen dramatic improvements once their vitamin D3 level is raised. Truth be told, there have been 2 papers recently that show people who suffer from multiple sclerosis, if they have 100 units of vitamin D3 every day, it actually reduces the incidence of their multiple sclerosis attacks. Now, at that value, we are certainly suggesting that that be done under the direction of a physician. But it just goes to show you that at the so-called toxic level, these people with multiple sclerosis are not becoming toxic, and their incidence is reduced. But in comparison to cancer and heart disease, stroke, blood pressure, eye disease, where there's a low vitamin D, multiple sclerosis is actually low on the scale. I'm talking about that to prove that they are given doses that should be toxic, and yet all that it does is reduces their incidence. I suggest that you start taking vitamin D3, 5,000 units once a day after food, and within 2 months, go to your physician, have them check your blood, and if it's not 45, I would increase the dosage, but that's up to the physician. As a starting dose, 5,000 units once a day is fine. Taking of multivitamins does not work. Many studies of studies called meta-analyses have proved that multivitamins do not work. The other multivitamin that should be taken is B12 if you are a vegetarian, because a shortage of B12 can lead to a serious blood disorder called pernicious anemia that can be serious. So vegetarians are urged to take about 1,000 units of B12 a day. Oftentimes I've heard people say, oh, since I take this multivitamin, I'm feeling so much better. What it actually is, in medical parlance, it's called the placebo effect. The fact that the patients are taking something, in their mind, they are feeling much better. But study upon study, studies of studies, including hundreds of thousands of patients, have shown that multivitamins do not work. Vitamin D is the only one that you should take. Now, even if you're living in a sunny area, how often do you get into the sun? If you live in an area where you get a lot of clouds and snow, all the more reason for taking adequate vitamin D. But living in Southern California, for argument's sake, where you have sunshine most of the year, most adults are in the office working. Seniors, even if they spend time in the sun, the senior skin does not absorb the vitamin D. And it's in the seniors that most of these diseases occur, although cancer is coming among young people as well, especially the breast and the prostate, etc. So I urge you, for your health, take 5,000 units of vitamin D3 once a day after your main meal, and you will live a longer, happier, healthier life. My name is Dr. Hillel Mazansky, and I thank you for listening to the video.